Hello, my name is Nick Garrelay, and I'm the founder and CEO of My Florida Green. We are a patient management platform that facilitates the medical marijuana certification process for both the certifying physician and the qualifying patient. Please know that I am not a physician, but I have been part of over 40,000 patient transformations. We've documented over 60% of our patients have reduced the need for prescribed medications that they wanted to get off of. We've documented that 85% of our patients succeed in treating their ailment with access to cannabis, and we look forward to having you on the My Florida Green platform. We've compiled this video to assist you in streamlining the medical marijuana certification process. We want to make sure you, as a patient, understand the medicinal benefits of cannabis so that you can incorporate this healing plant into your everyday life. Let's get started. We're all born with an endocannabinoid system. This is a series of receptors throughout your central nervous system, your organs, all the way down to your bones, and it's responsible for promoting harmonic balance. Once we harmonically balance, we accomplish homeostasis, which is the status the human body needs to reach in order to heal itself naturally. Sounds simple, right? Well, this system that is responsible for our natural ability to heal is constantly violated through drugs, toxins, alcohol, prescriptions, and chemicals throughout our entire life right from birth. This constant stress will eventually cause illness and disease. What we've discovered is that we as humans can promote our natural ability to heal when we can avoid these conditions and negate the need for treatment with prescription medications, which cause side effects and the need for more medications. With medical cannabis, we're incorporating phytocannabinoids from the plant that almost identically match our endocannabinoids, endo being inside, which will literally fuel your system's natural ability to heal. There are 160 cannabinoids to the plant. In this slide, we're showing you the top 8, but we're going to focus on the 2 most medicinal, which is THC and CBD. THC, which is short for tetrahydrocannabinol, is the psychotropic part of the plant, known as the fun stuff. THC is primarily used to treat pain, escape, sleep, and also having a little fun. CBD, which is short for cannabidiol, is actually the most medicinal cannabinoid of the plant. CBD is known to treat anxiety, inflammation, blood pressure, and blood sugar regulation, just to name a few. In order to promote harmonic balance through homeostasis, it's important to incorporate both THC and CBD on a daily basis, but in a way you can handle, not necessarily at the same time. It's best and most responsible to onboard THC at night. This way, if there's any unwelcomed high or psychotropic, you're going to bed and you don't ruin the day. Onboarding CBD during the day can be life-changing, providing the CBD is real and of quality and a full spectrum of cannabinoids. We recommend CBD 2 to 3 times per day. This will regulate your blood sugar, your blood pressure, while controlling your inflammation and anxiety. This is a great balancer. Now let's talk about how these work together and how you can control the onset of THC with CBD. The THC binds to the receptor, and this is what causes the psychotropic effect. CBD blocks the receptor so it can reverse this effect. If you take a THC product that has pushed you over the limit and you don't like how you feel, you can take CBD, which will ultimately reverse the unwanted effect, sometimes pretty rapidly. So to simplify, if you get high and you don't like how you feel, CBD can bring you back down as a parachute. If your THC level is low and your CBD is high, you'll most likely be okay. So once you incorporate both CBD and THC in equal parts or above, you'll most likely experience a psychotropic effect. So keep CBD high during the day and then your THC higher at night. Let's talk about strains. Sativa and Indica are the 2 most common strains with the plant. Sativa, for most, is stimulating, appetite suppressing, and energizing. This strain can cause anxiety, so think of it as caffeine. Indica, which is also known as Indicouch, is known to be the sedative and relaxing strain for most, and it's good for the PMs. It's great to induce sleep and relax. This is also the preferred strain for cancer treatments. Speaking of cancer, THC is the cannabinoid known for improving cancer treatments. THC can bind to the cancer cell and cause apoptosis, where the cancer cell will actually eat itself from the inside out, and CBD can block cancer cells from metastasizing. Let's talk about how to use medical marijuana. Currently, there are several routes of administration. We have inhalation in the form of vaping or smoking flower, sublingual, capsules and edibles, concentrated oil, and topical. The inhalation is the oldest, fastest, most controlled, and preferred route. When you breathe in, the capillaries in your lungs will trap the vapor smoke and deliver the cannabinoids to your bloodstream almost instantly. Inhalation is considered a route for treatment and not a preventative. This route can help ease your pain or trick your mind into forgetting about it. This method does not replenish your endocannabinoid system, so we consider it a treatment, but it does offer an instant onset for rapid relief. The relief period for inhalation can typically run from 30 minutes to 2 hours on average. So sublingual is known to be one of the most medicinal routes of administration. It's suggested to hold the oil under the tongue for at least 60 seconds. During this time, an average of 10 to 20% will absorb rapidly with the mucous membranes under the tongue, and the rest will metabolize when you swallow. Keep in mind, the longer you hold it in your mouth, the faster it's going to absorb. Now you're replenishing your endocannabinoid system because now you're breaking it down and metabolizing, where smoking or inhalation onboards and passes almost instantly, right? When you're breaking cannabinoids down through your digestive system, now you're replenishing your endocannabinoid system. Capsules and edibles should be used with caution, as this is an uncontrollable route of administration, but it can be very effective. When you ingest and swallow a capsule or an edible, it can take sometimes an hour or even 2 before you feel the effects. The onset or relief can depend on the amount of food that's in your belly. Expect a longer onset with a full belly and a rapid onset on an empty stomach. Once you metabolize an edible or a capsule, your liver will convert the THC into 11-hydroxy monohydrate. For some patients, this can accelerate the psychotropic effect of THC and even make it stronger. For some patients, they don't feel THC in an edible format at all. Everybody's different. The psychotropic effect of an edible or a capsule will most likely resemble more of a body buzz, which is why it's recommended for patients suffering with pain or deeper ailments. This route has shown effectiveness with reducing the need for prescribed medications like benzodiazepines and opioids. Inexperienced patients should try their first edible or capsule 1 to 2 hours before bed. This will give the patient time to assess the relief that they receive, and if they become uncomfortable, it's the end of the day and they can prepare for a great night's sleep. The average relief period from a capsule or an edible can range between 6 and 10 hours or beyond, so keep in mind everybody's different. The last one is topical. Topical can be very effective but temporary. Rubbing topicals in localized areas can assist with arthritic pain and skin issues, and sometimes even pain. Typical relief periods range from 30 minutes to 2 hours. We recommend waiting at least 30 minutes after the shower or bath before applying a THC topical to the skin. Your pores are open after the exposure to hot water, and you may subject yourself to an unwanted psychotropic effect. Remember, if you're new to medical marijuana, it's suggested to have a CBD tincture on hand to help neutralize the psychotropic effect as you experiment with THC products. Ladies and gentlemen, it's important to know that medical marijuana or cannabis is an individual response, meaning everyone responds differently. We hope to empower patients with education and access so that they can experiment and titrate on their own. Staying on a consistent regimen with THC and CBD for 30 to 45 days should yield a positive result. For beginners, a THC tincture at bedtime combined with CBD through a tincture 2 to 3 times per day should be a great strategy to establish a great foundation. We recommend this schedule in conjunction with experimenting with products, as the key is consistency. Thank you for watching, and we wish you a successful journey as you incorporate medical marijuana into your daily life. Happy healing.